One of the things that was interesting in the last day they talked about just even diagnosing the disease lately has become more of a more controversial among us experts, which was very interesting to watch. And they present people's cases and argue whether their biopsies and their high-risk CTs constituted the classic IPF pattern. And so there's still a lot of ongoing discussion on that. But I thought, well, every person knows if their lungs are injured, they need something that's helping them. And all of this, no matter if it's strictly idiopathic, if it does have other problems as well, there still needs to be some way to stop that continuing damage in the lungs. And they also they also talked about regular lung transplant, that they're improving that so that the rejection will be less. The problems with rejection are the main things in developing other lung issues. But Dr. Schwartz also said that if you're dealing with clinical trials, you should have consider, or with anybody with IPF, if your doctor hasn't evaluated these areas, they should, in which this presentation also addressed for sleep apnea, GERD, rehab, pulmonary rehab. Make sure you've received all your vaccinations for flu and pneumovax, and also make sure your doctors know what's bothering you now, because sometimes they look at the disease and not the patient, and so you remind the doctors to what is bothering your patient now. And he also said, and almost universally all the IPF patients have GERD, so he said keep that under control, but they also have to realize that it's not just the acid in your stomach that is causing it, that there is also pepsin and bile salts. So he said it's really important that you do the functional things like raising the head of your bed, because that won't, the acid blockers alone won't keep that bile or other issues from possibly still damaging your lungs. So that's one thing that I hadn't been clear on before, is that you could, there are obviously other things in your stomach secretions that can be damaging. I don't have any, those are, one thing that was really exciting to me back there was to see there is a growing excitement and a national awareness of IPF, and it was sold out, that it was big. They had a dinner meeting at a museum there that was exciting to see all the people who are starting to contribute now, and of course some corporations and some wealthy individuals who really want to see this disease tackled, and to see that the Congress helped get the registry started, which there's been some progress on that, and the website here at the Pulmonary Fibrosis Foundation, they can help, you can contribute there and see, do what you can, or just call our Congress people and remind them that this is an important thing, that we need to get a registry, and so we can learn more about the disease, and more why people are getting it. Could be, and will be, very helpful. And also they talk about, environmental triggers. They don't know why, some people who even have the familial, why some family members do have it and don't, even if they have the gene that is for it. And so maybe just be careful about, remind your children and grandchildren that to protect their lungs. Don't take anything for granted. And now we live in Utah, and we've got to address our pollution issues here, which are, unfortunately, we were named the most polluted city in Salt Lake air-wise last year. I don't know if that was, someone was telling us, I said, no, we're doing a pollution study at our office downtown, and I thought, really, we're worse than LA? And not every day, but on our bad days, we are worse here. And if the families that have linked together in our research, I think, we've got to advise people, don't exercise in the bad air, because we don't know what is the damage. Maybe that isn't even it at all, but we are seeing increasing people with lung problems of all kinds, not just IPF, because of, we assume, of course, it could be obesity that causes GERD, that causes, and it's, there's so many factors, but we know the pollution is not healthy for us, so we can think of ways to help our community deal with that, and think of someone who can figure out. I was thinking we got to put some kind of filters on the freeways or something to capture all that exhaust, and apparently they're saying that Kennecott plays a bigger role than what they thought, but I don't know. So, anyway, that's really a very loosely some of the highlights that I got from the doctors there. If any questions about what I've said so far? It isn't a startling revelations, but some of it is exciting about the biomarkers, and that's how they've started to deal with cancers more, and the fact that they've isolated a few more of those proteins that could be, once they know what they are and the increased levels, that they can counteract them. So that's very hopeful. Anybody have any comments or anything you'd like to say or ask a question? Yeah.
I just know in the last meeting we talked about some fundraising efforts that people had in mind, and to get the word out there on IPF in our community, and hopefully go bigger than that. Has there been any leadway with potential fundraisers for this year, or?
Yes, one of our members' family is going to do a run in St. George. They're organizing a IPF run in St. George.
Cool.
He was a former marathoner, and we've got our Myrna in Idaho, whose husband had the golf club collection, and she has a website where people can buy those golf clubs, and then she donates some money for that. So that's something. But if you have some time, and we did have another sub meeting, and we had some people get together, and then Steve Castoldi, he was here, he had his letter to the editor printed in his insurance companies, how they send you letters and things, and he talked about pulmonary fibrosis because they had mentioned it, and so there are just little things you can do to make other people aware of this problem and that it's increasing. And so we need to, now is a good time. If you have other topics you'd like to see addressed, if you have questions about any of the clinical trials, I'm happy to answer those, the ones we're currently doing. Yes?
I have one question on your term on implants. Since there's an age limitation.
Transplants, you mean?
Yes.
Okay.
Here in this state and elsewhere, that restricts dang everybody in this room getting one, including myself. What did you mention they're doing this laddering program that they're looking at using some of your own body cells to help regenerate some of this area? Go through that again.
Okay, it was very, when they were talking about new frontiers in lung disease, so he was just saying that they have developed they're still at the animal level, but they've developed like a lung structure, so your lungs have the more denser structures in the lung, they've developed that, and then they will put tissue on of their own for animals, and they've done it like in skin grafts and things like that before, and now they thought if we had a structure that we could put lung tissue on, then that would be helpful. So they were just talking about or taking, actually, another way they were actually doing it, reminded me of this, is they're taking the lungs from people who've donated them that maybe weren't right, and then they wash them and get rid of a lot of the things that would cause rejection, just the skin, and then just use the structure from these donated lungs to implant. They're thinking that that would be a possibility, so there would be less of all the problems with rejection, which is the biggest downside of lung transplantation. So that's what he was going. I'm sorry I don't have clearer notes of other things. They haven't posted that presentation online yet. I was hoping they would do that so I could get it clear, because I thought that was quite exciting that they would do it, but that they're working in that area and trying to.
So you're saying that they are proposing that they work in that area because they've done it for other things, or they actually are working on it now?
They're working on that now.
For lung tissue?
With lung, in animals more than obviously the people. They haven't done it with people. That they harvested lungs and then they rinse them and then try and put a new structure onto them. You know, just the undamaged lungs. Their structure is good. So it seems, yeah.
Is this a stem cell thing?
I can't remember for sure. I think it might have been, but I'm not positive. But however, they can do cell growth, so it must have had some kind of stem cell background. But I'll try and find out more information on that part. But I just to briefly tell you, it's nothing that's going to happen next year or even the next. But it's hopeful for the future to see the direction they're going to try and make that a viable option for people. So another thing that since we've been together, we did the Panther study, which did prednisone, azathioprine, and NAC. And the results of that study showed that people with pulmonary fibrosis, idiopathic pulmonary fibrosis particularly, are not benefited by the use of prednisone and azathioprine. And that they had that, they've actually proved that it was harmful and that prednisone, and because it's been such a standard treatment and there have been such discussion, so this was a very important trial. And that was one thing they talked about a lot at that meeting also, was the importance of that Panther trial in proving that prednisone, it's good for exacerbations in your disease, but it will not cure you. And actually, in the long run, even though it makes you feel better in the short term to have prednisone, and then your doctor still may say, if you're having a flare-up, give you a short burst of prednisone or something, but they proved that the azathioprine is harmful to people with IPF. So that was a very important study, and they did stress that a lot. So some of your own pulmonologists may not be aware of that finding at this time. So you might want to acknowledge that. Yes?
I also heard that another part of that is the standard treatment is now going to be just the NAC. Well,
NAC is they're still carrying on. We're doing that study and continuing on with it. And that the NAC is N-acetylcysteine, and they're doing it versus placebo as well to see if it actually is beneficial. And because that, in Europe, they would really push the prednisone, azathioprine, NAC, and that's so we wanted to make sure, if this is a valuable therapy, we want to do it because they use the three in combination. Well, we definitely proved that the three in combination wasn't, that the one they haven't, and they felt like the side effects from NAC are not significant. So if it does help, and if it is helping people, we obviously want to know, and so that's why we're continuing on with that study to see if the NAC is beneficial, and so that is ongoing. And I know that they talked about suppliers. One thing about NAC locally, it is available in health food stores, but if you want to be on a current trial, let me just give you this, most of them, I think there's only one trial that we currently have, will let you take NAC and participate in the trial. So they don't want you to muddy the waters if you're going to be in another trial. So, and the NAC that is available here in the United States is not standardized. There's one